Good morning, everyone. Welcome to Metro Hall, and thank you all for joining us for some very important news this morning. Our goal every day at Metro County government is to make Louisville a safer, stronger, and healthier city. And today's announcement helps on every aspect of that goal, because we're receiving the first in a series of multi-million-dollar payments that will help us deal with a deadly epidemic that's plaguing our city. I'm talking about substance use disorder, addiction. It kills more of our friends, neighbors, and loved ones than homicides and traffic accidents combined. According to the Kentucky Office of Drug Control Policy, we lost more than 500 people to overdose in Louisville last year. Over one person every day is dying as a result of an overdose and substance addiction. And one of the biggest reasons for all of those deaths is opioids. And the impact of opioids like fentanyl goes beyond the deaths. It wrecks lives and families. It contributes to challenges like homelessness and public safety. This is something that Metro government and our Department of Public Health and Wellness has been fighting for years in partnership with LMPD, emergency services, the state and federal government, and allies in the private sector. Our interim chief health strategist, Connie Mendel, is with us, and she will detail those efforts in a moment. But first, I'm announcing that we'll be receiving millions of dollars of funding to fight the impact of opioid addiction in Louisville. This money comes from legal settlements with opioids distributors, dispensers, and manufacturers. And I'm also announcing that we've developed a plan for how to use these resources to benefit our community. By the end of this year, Metro government and other local agencies will receive payments of over $7 million to support our efforts to fight opioid addiction. For context, last year, Louisville Jefferson County announced that we would receive approximately $32 million over the course of 18 years to help us work with people affected by substance use. Then, just last month, there were additional settlement agreements reached with opioid dispensers and manufacturers. And because of that, Louisville Jefferson County will now receive more than $57 million in settlement funds over the life of these settlements. This is in addition to the state's share of the opioid settlement dollars. And that's good news for this really important work. And we'll talk about the details of how we'll use that money in a moment. But let's remember where this money comes from and why we're getting it. This is not federal funding. This is not state funding. This is not taxpayer money. This is money that companies agreed to pay after it became clear that they had failed to monitor and report suspicious shipments of opioids. They profited off the pain, misery, and suffering of people in our community and communities all across America. They saw that these pills were making a lot of money while also destroying lives and families and communities. And they kept pushing them anyway. It's a business conducted without a conscience. And people in our city, in every zip code in our city, in every neighborhood, and all across America were hurt by this. So it's absolutely appropriate that the companies and individuals who work to create this epidemic pay for at least some of the costs of dealing with the epidemic that we're now struggling with. All that said, we are very gratified to get these funds that we are owed. And we and our partners are ready to put them to work for the people of Louisville. I want to give a special thanks to County Attorney Mike O'Connell and his entire office, who's represented by Sarah Martin, who you'll hear from in a moment. Thanks to them and their entire team for leading the effort of this litigation, which has led us to this day. Let me give you an overview of what we're doing with this first round of opioid settlement funding. And please note that this decision and how we're allocating these funds was informed by local data, national models for best practice, and input from community organizations providing evidence-based harm reduction services. First, more than $1.5 million will be invested in community partners that focus on harm reduction. That means outreach, education, overdose prevention, Narcan distribution, screening for HIV and hepatitis C, and improving access to medical, mental health, and social services. We've got great partners like Kentucky Harm Reduction Coalition, University of Kentucky Target 4, Feed Louisville, and of course, our outstanding team at Metro Public Health and Wellness. We're also going to use about $250,000 to set up and support an opioid settlement distribution advisory board that I will appoint. This board will work with a project manager and an outside evaluator to help us make sure we're investing these funds in ways that will produce transformative change for people and communities most affected by the opioid epidemic, with a particular focus on underserved communities. And to round out this year's funding, we'll be making about $5.3 million available for additional organizations who submit competitive proposals later this fall that align with the approved uses of this settlement. We're looking for partners and proposals that will help us address the impact of opioid addiction in our city, prevent youth addiction, help those who are homeless or those who are at risk of becoming homeless, and promote long-term recovery. We'll share more details about the application process in the months ahead. Right now, I'd like to turn things over to some of our outstanding community partners who are going to be on the front lines of doing this important work. First, let's hear from Sarah Martin. As I mentioned, Sarah is the Civil Division Director at the Jefferson County Attorney's Office, and her colleagues, along with Mike O'Connell, were importantly responsible for helping us get these settlement funds to invest in our community. Sarah?
Thank you, Mayor Greenberg. Again, my name is Sarah Martin. I'm with the Jefferson County Attorney's Office, and I'm here on behalf of Mike O'Connell, who unfortunately had a conflict today and couldn't be here to celebrate with this wonderful team today. This is one of Mike O'Connell's most proud accomplishments as Jefferson County Attorney. It was to make the recommendation to Louisville Metro government to be one of the first cities who filed against these opioid distributors. And so today is especially important for Mike, as the many years of our work on this case has now resulted in community action and community healing. And many of you know this issue is very important and personal for Mike, as it is for far too many families throughout our community and throughout the country. Louisville's legal journey began back in 2017 when we filed a lawsuit against three of the nation's largest drug distributors who played a role in creating this opioid epidemic. Those were AmerisourceBergen, Cardinal Health, and McKesson, with Johnson & Johnson later joining the lawsuit. And in 2021, that lawsuit, the initial lawsuit, resulted in a $26 billion settlement with cities across the country and states across the country, with approximately $30 million that will be allocated to Louisville Metro government in this initial settlement. And as the mayor said, there have been additional settlements since then, and that's why these new developments is part of why we're here today, and also the money that is starting to be received by Louisville Metro government to help Louisville and the community so impacted by the opioid epidemic. So, as the mayor also said, this $57 million that'll come to Jefferson County is separate and distinct from the money that goes to the state. There was a state law passed a couple of years ago that determined how these settlement funds will be paid, and with 50% of the money going to the state and the 50% of money going to local communities. And it's possible even that a sizable portion of the state money could make its way back to Jefferson County, which will be additional money to the $57 million that Louisville Metro government will receive. And as the mayor said, these settlement funds can be used in approved areas like treatment, prevention, and other strategies to assist the opioid-related problems. So again, today is a very proud moment for the Jefferson County Attorney's Office. We were so pleased to be instrumental in bringing these settlement funds to Louisville Metro government. And we hope that our work and the dollars that will flow to combat the opioid harms will serve as a tribute to those families who have lost loved ones and were impacted by the opioid epidemic, and for generations to come prevent additional problems like this happening in the future. Thank you so much.
Thank you so much, Sarah, and thanks to all of your colleagues at County Attorney Mike O'Connell's office for your tireless effort to first bring this issue to Louisville Metro government and then to continue to be involved. This $57 million of settlement funds will be wisely invested to help prevent additional opioid epidemic devastation in our community. Thank you so much. Now let's hear from Connie Mendel. Connie is currently serving as Louisville's interim chief health strategist and is an integral part of working with our entire team at Louisville Metro Public Health and Wellness about how we'll be partnering with these organizations and put this money to good use for important purposes. Connie?
Hi, Connie Mendel. So sharing some information regarding the settlement and how we're going to use the funds. So recently, Governor Beshear released the 2022 Kentucky Overdose Fatality Report. Last year, 2,135 Kentuckians lost their lives to drug overdose. While that is a decline of about 5% from the previous year, we know that every overdose death can be prevented. Even one is too much. But the decline gives us hope that we can prevent more, and that the harm reduction strategies being used across Louisville and the state are working. Since 2015, we've been providing harm reduction services to people with substance use disorders. Harm reduction is a set of evidence-based, practical strategies aimed at reducing negative consequences associated with drug use. It includes a spectrum of strategies, including safer use, managed use, abstinence, and treating people who use drugs with dignity and compassion, and meeting them where they are, to help them regain healthy life and reduce the impact of drug use in our community. Our harm reduction services include screening and linkage to care for HIV, viral hepatitis, providing free Narcan and overdose prevention education, as well as fentanyl strips, safe syringe disposal, referrals to treatment providers, as well as other social, mental health, medical, and recovery resources. Since 2015, our team and our harm reduction outreach services program has helped more than 27,500 people by providing that free Narcan kits and overdose prevention training to residents and community partners. And there have been nearly 11,000 self-reported overdose reversals. So I have to acknowledge the Harm Reduction Outreach Services team and our community partners in this work. They are amazing. The work is challenging, but our team and partners are compassionate, committed, and dedicated to helping people who use drugs by equipping them with life-saving tools and information to create positive change in their lives. But there's more work to be done. Last year, while total overdose deaths declined in Kentucky, the state saw an increase in overdose deaths among our Black residents. Local coroner data deaggravated by race has not been released yet, but the trend continues to be a local trend as we've seen overdose deaths of Black residents increasing nearly tenfold between 2011 and 2021, while overdose deaths among white residents tripled. When we put forth our recommendations for spending settlement funds, we reviewed local data, national trends, and national models for best practices and solicited input from community organizations providing evidence-based harm reduction services. The goal of our recommendations is to increase opportunities for everyone to live their healthiest life and reach their full human potential by continuing to invest in evidence-based solutions for substance use prevention and addressing the needs of people who experience the greatest barrier to accessing harm reduction, treatment, and recovery services. One of the initial organizations that will receive funding is a valued expert and partner in providing harm reduction services, the Kentucky Harm Reduction Coalition. So do I go ahead? Okay, so I'd like to introduce their executive director, Shrita Walden, to say more.
Thank you. Wow. Okay. So thank you, Connie, for that wonderful introduction. And you saved me some time with sharing about the history of harm reduction. Just to add to what Connie said before I get started, is Kentucky Harm Reduction Coalition was a part of that partnership back in 2015 to answer that call. And I'll share a little bit more about that in my say. So yes, I'm Shrita Walden, the executive director for Kentucky Harm Reduction Coalition, have been in this role since January of 2022. Good morning. First, I would like to say I stand in solidarity with my people, my families, our community. I am the people. In full transparency, I had a difficult time preparing for today. I don't do much discussing when I don't have something in writing. Although our most recent overdose fatality report demonstrated the 5% decrease, that report did not initially involve the Black, Indigenous, and people of color community. And I'm so happy to hear the modifications to what was sent out initially, because it was hurtful. Harm reduction in its essential form, where the Black Panther Party and the Young Lords came together, was to meet people where they were at and to do no harm to anyone. So I found that harmful, so I appreciate Connie coming in and sharing about that. So we are in a crisis. I know I said that with a smile, I apologize. We are in a crisis. We don't get to celebrate until we can lower the numbers for everyone, not for just one community. Thank you, Mayor, and everyone else in your team for inviting me to speak today. Kentucky Harm Reduction's history was birthed out of a critical need. Our partners locked arms with three of the folks that helped build this organization, initially at a coffee table in 2014. I'm not telling y'all which coffee table because we're not making no money, right? So they were sitting around a coffee table. These individuals with Donald Davis with lived experience, Russ Reed, who's over Beacon House, and Arlene Rice came together. Arlene lost her son. So those numbers back in 2014 and 2015 involve real people. And they said, we gotta do something, because when she was looking for services, she couldn't find them. They didn't exist. So this partnership, this beautiful journey began with our local health department. What happened? We started providing disease prevention, overdose prevention. See, you guys are used to hearing syringe services program, but that seems to carry a stigma. So let me just tell you what it is disease prevention, death prevention, fentanyl test strips, poisoning prevention. Let's shift the language. We provided overdose training and naloxone training. This went from just starting in small spaces in Jefferson County to spreading across the state of Kentucky. COVID did not shut down KYHRC. It actually provided an opportunity to expand to mail-based distribution, and we became the first organization to start expanding and shipping naloxone to our brothers and sisters in the smaller and rural counties. We have mobile outreach, and in the last year, when I came on board with KYHRC, and we started really amping up our outreach, our mobile outreach and access to psychiatric care and substance use disorder treatment, we were able, with our partnership with U of L and Dr. Stewart, to finally get at least 50 people connected to some form of substance use disorder treatment. We continue to build partnerships, strong partnerships with grassroots organizations like Feed Louisville, Omni Resources, and stabilize our partnership with Louisville Metro Public Health and Wellness in UK, Target 4. Harm reduction is meeting people where they're at. SAMHSA put a beautiful definition to it, but it's simple, you guys. We meet people where they're at. We get out of the office and go on the street. That's literally what we do. We go to the community without judgment and meet people. In fact, it starts with a participant, and we even meet our legislators and our people at the top who really don't have lived experience. We meet them where they're at, and we provide engagement, education, and empowerment. We engage our constituents, we engage our participants, we educate, and then we empower you to make great decisions. Our work has been recognized locally and nationally. However, I'm not going to gloat and I'm not going to boast because it does not negate the families that I reach. I am not proud. You tell me how to be proud when I'm talking to a mom whose daughter lost her life needlessly from poisoning and had to build an organization like Morgan's Mission. That's birthed out of hurt and trauma. I'm not proud when just 3 days ago, on Monday, a beautiful Monday morning at 8 o'clock in the morning on July 10th, a woman who sat from having surgery just a little while ago, and you could see her belongings out on the street, had to deal with being swept away and pushed into another community because she has nowhere to go. How do I be proud when my organization submitted the request on time for funding to start July 1, and yet we are 13 days into the new fiscal year and haven't received any word? How can I be proud? How do I get to sit here and smile at you all and say, I'm doing such a great job? I'm not, and I can't. Unlike our city, state, and national government leaders, I will not stand in front of you, parents, partners, friends, spouses, loved ones, and speak empty promises and unrealistic hope. I'm not going to tell you what I can do without having what I need. That's not fair. Fred Hampton said, we're going to have to do more than talk. We're going to have to do more than listen. We're going to have to do more than learn. We're going to have to start getting out there with the people. That's it. Truth is, we have a very long way to go. I need you. There is power in us, the people. KYHRC and our partners in this work, this movement, have the knowledge, the skill, the experience, the plans to solve this problem. Look it up. I didn't have to come up here and tell you all. People have been going to my LinkedIn, our web pages, on our website. They've been doing everything to research and see, what is this little black girl from Chicago? What's she talking about, right? People have been doing it, so go do it. Do your research. Do your research and see that what we're doing works. Do your research to see why California just awarded $60 million over 4 years for harm reduction efforts. That's pretty cool. And we still at number 3 for fatalities. We're much smaller than California, aren't we? Aren't we smaller than California? So why are we beating, not in horse races, we're beating in deaths that we could do something about? We need your help to ensure we get to do the work in our community. What can you do? Even you that sit here in your positions of power and privilege. Those of you that are watching this, there are things that you can actively do. We need you to call your Metro Council members and apply pressure. Ask, why haven't you approved this funding yet? What is Sharita talking about? Call the mayor's office and apply pressure. Ask, why do they keep displacing folks, moving them around the city with no solutions? Call JCPS, school board. Ask why aren't they partnering with Kentucky Harm Reduction Coalition to provide naloxone education and prevention with our 10 years of experience. You just heard everybody talk about it. Our bio is standing on the stage. So what's the holdup? You don't trust us? Join our meetings. We're not doing anything in secrecy, you guys. We're fully transparent. Come to talk to us. Vocal has members meetings. Members are you, anyone at any level. From a participant on the street all the way up to a leader who's leading our government. You can come sit in that meeting. You can also send your moles and tell them to come tell you what happened. Join Feed Louisville's meetings. Find out what's happening. Join us for outreach. Come walk with us. Y'all, I take this skirt off and these cute little sandals I have on and these earrings, and I go throw on my gym shoes. Yes, I'm from Chicago, so I call them gym shoes. I throw on my gym shoes and my jeans, and I go out there with my team. I'm not sitting behind a comfy desk. Show up to the town halls. Show up to talk to us. Black and brown folks, show up. We're dying. We're dying. Show our government leaders you care about the solution and your voice is needed at the table. Without you, we cannot do what needs to be done. Harm reduction is built off of the premise of nothing for us or about us without us. So we need your voice. You don't like how the money is being spent? Come talk about it. Say something about it. Sit at the table. You have an idea? Come tell us. Come tell them. You know who did that? You know who joined and brought their voice to the table because we welcomed them? My friend that's going to come to this podium. My friend, my colleague, my family. Ryan Jacobs has something to share with you. Because at the end of the day, my license as a licensed clinical alcohol drug counselor with 16 years of experience and can speak very well. Some people tell me that. I speak so well. All of this doesn't matter because you know what? Ryan's voice actually matters because he's the one with the lived experience of the work that I do. So guess who I get my answers from? Him. I talk to the people who matter. So at the end of the day, my voice is cool. I know I sound good. But Ryan is who it's about. He's a member of Vocal Kentucky. He speaks on what's going on. He shares his experience authentically and transparently and with a humility that I love. And I'm very protective of him because you know what? We tend to use people. Oh, he's got a story. It's going to grab at the hearts. I'm very protective of our people. He's a member of our board, Kentucky Harm Reduction Coalition, because we're supposed to have people with lived experience involved in making decisions because any other way would be privileged and oppressive. And now he's working. He's working with one of the programs that he can say he participated in. So I look forward to sharing space and passing the mic to the most important person on this stage right now. Ryan, thank you for being with us.
I don't know if I can do much better than her, but thank you very much. Excuse me. Good morning, everyone. I'd like to thank Mayor Greensburg and all the community partners for showing up today, who are invested in this vision of bringing harm reduction, awareness, education, healing to our needed communities and the entire city of Louisville. I would also like to thank the media for being here and for the opportunity to share my story with all of you. I grew up in rural America. Right across the bridge over in Salem, Indiana is where I went to high school. I was a shy kid, kind of kept to myself, dreamed of being president, but one day, and in high school, my social circle was mostly just the band kids. I was pretty shy and kept a small social network. Back then especially, I lived in a world where being gay wasn't a norm. There wasn't that vision in society. So in my political leadership, in my media, there was never any representation of me. And that caused me to live my life in the shadows. After I graduated high school, I began experimenting with drugs. For me, that was my escape, and that was my answer to my shy, unexciting life. They opened up a world of social connection, relationships, and a new culture where I felt like I fit in. Unfortunately, I fell into the trap that too many do fall into as well. As my drug use progressed, it became a crutch in my life. I later moved to Louisville, and my social network became consumed by those that were in this lifestyle. After a while, I went from socially using to self-medicating. I began using to escape from the problems the drugs were causing in my life. I lost many jobs, housing, and eventually I was diagnosed with HIV. And I even lost a very dear loved one due to his battle with the war on drugs and his use. In spite of all of that, I couldn't bring myself to ask for help. And I considered diving more into isolation. It was during that time that I began using intravenously, and I began injecting drugs. And I utilized the harm reduction services at the Louisville Metro Public Health and Wellness Department. I cannot begin to tell you how much strength it took for me to build up to be able to walk into those doors. But looking back on it now, I can tell you that's what saved my life. You see, when I went there, I was treated with dignity and respect. I never once felt judged, and I never once felt the stigma of being just a user. This really became one of the only places that I felt like I was accepted. And that's also where I met Jennifer Twyman, a dear friend now. Having developed a trusting relationship with her at the Syringe Service Program, I felt safe confiding in her and my story, and in time began working with her through an advocacy group called Vocal Kentucky. Over time, I began to suffer from drug-induced psychosis. By then, I knew I had hit my own rock bottom. I could handle all the loss up to that point, but when I started losing my grip on reality, that's when I knew I had to make a choice. Without judgment or persuasion, Jennifer was able to connect me to care through an outpatient recovery program on my own terms. Through working the program and becoming a leader and advocate in Vocal Kentucky, I was able to find a path to my recovery. It was through sharing my story at our Harm Reduction Symposium that I was connected with the people at Target 4, Region 5, and I found that I could turn these struggles into strengths and give back to the community in which I've been living. I stand before you today, a son to a wonderful mother, a very understanding mother, a brother, a friend, a voice for those who have none, a resident of the Arthur Street Hotel, thanks to Feed Louisville, a member of the board of directors for the Kentucky Harm Reduction Coalition, and a peer prevention specialist at UK's Target 4 program, where I get to provide the services that I once utilized. It's been a great honor for me to share my story today. My hope is that we can continue this work because I'm a testament to what these organizations do, and I'm proud to have been a part of them in my short-lived experience so far. This opportunity for the city of Louisville to receive these abatement funds to support programs with the same mission as ours is just the tip of the iceberg. I heard in one of our harm reduction training sessions that the opposite of addiction is connection. Truer words have never been spoken with regard to this crisis that we faced for far too long. I'm grateful to Mayor Greenberg and to the city of Louisville for their support in our program, and look forward to building more connections in our most vulnerable communities with these funds. I'm a firm believer in the slogan, "Nothing about us without us," because every life matters. Thank you very much.
Thank you so much, Ryan, for sharing your story. It is inspirational to all of us and just shows the importance of what we are beginning to invest in here today with these opioid settlement dollars and the important, impactful work that we can do by investing in organizations like the Kentucky Harm Reduction Coalition, like Feed Louisville that is represented here today by Donnie, and the important work that they're doing around our entire city. And we will continue to make positive, impactful investments because this issue is not going to go away without meaningful and targeted effort like you heard about from Sharita and from Raya. And so Connie and Dr. Inder Singhal, our interim medical director at the Public Health Department, are going to be working with all of the colleagues in that department to ensure that we continue to move forward with thought, with effort, and with a real focus on addressing this issue and working to save lives as best we can.